We all know at the moment that it's challenging times. We can't dispute that. I don't need to go through all of these reports, you're all aware of them. And it is challenging times for our profession, and therefore it's challenging times for our education and for our student midwives. And, you know, very recently we've had the report led by Mary Renfrew into review of maternity services in Northern Ireland. That's the most recent report, a very detailed evidence-based report. But all of these are throwing up the same themes, that we have challenges in maternity care that we need to be aware of. And then, if we're looking further afield, we have global challenges. And I make no apology, you know, I work closely with WHO. We have global challenges and we live in a global community. So we can't ignore those global challenges. There is war, there is famine, there are earthquakes, there are floods. And midwifery and maternity care continues in war-torn and in conflict areas. So there's even more challenges for midwifery education globally than we're facing here in the UK. And we need to be very mindful of that when we're thinking about what we're dealing with. So when we're continuing thinking about the global challenges, we need to acknowledge that across, even if we were just to think of the European region, but it's even more diverse globally, midwifery varies in terms of its educational preparation, in what midwives are allowed to do, what scope of practice they can practice to once they are qualified, and whether they're licensed or not. We also know maternity care is not always evidence-based. It's not always evidence-based in the UK, let alone globally. It's not always woman-centred. It's not always compassionate and respectful. And in some places, midwifery education is quite often taught by doctors or nurses. It's not taught by midwives. And often there's no hands-on practice-based education. Student midwives can go and observe, but they can't touch. That's a challenge. And it's also the challenge of having different academic levels of midwives. You know, when I go to some European countries, they talk about low-level degrees. They talk about low-level professions. You know, that's so odd for us here in the UK, but these are global challenges. And there has to be jobs, of course. So, you could think, well, here in the UK, you know, we're extremely fortunate, aren't we? We have really strong midwifery, we have regulation, we have a profession, and we are licensed as such, aren't we? We're regulated, we're licensed. And so we're really fortunate. And are we then sitting on our laurels? Are we resting very nicely, very happily here because we think we've got it right, particularly in education? Well, I can tell you, the world is waking up and saying actually the UK hasn't got it right anymore. And we need to be cognizant of that. We need to be mindful, and we need to be recognising what the challenges are and tackling them, meeting them. So I'm going to go through what I think are some of the challenges. Recruitment and retention. You know, we all in university settings hear these terms constantly, don't we? We're challenged on our recruitment, we're challenged on our retention. We're fortunate in the profession of midwifery in that recruitment is still quite good. We have a buoyant number of applicants, don't we? We usually manage to fill all of our places, different to our nursing colleagues and to some other professions. But recruitment is challenging. Are we getting the right people in? Are we widening access and reaching the right communities? Are we educating midwives who are fit for purpose for the communities they serve? I don't think we always get that right. We talk about it a lot, but it's difficult to be able to do that in practice. And then, how do we retain our students? That's another challenge, isn't it? Again, in midwifery, we're probably doing okay across the UK with retention. But I think it's getting more challenging for us all the time. Students are leaving, they are stepping off programmes, they're not always able to come back. And we need to be looking into that. And I would suggest student expectation is a big thing we need to be considering. That's one of our challenges. Many of our students now are paying for their own courses. They're paying £9,500, very different to what it was maybe 10 years ago. They expect what they want from a university. And our universities, our HEIs are saying to us, student expectation is the key thing, you must meet it. But what the universities aren't always understanding is we are a professional programme. We're not just here to give students degrees. We are preparing them to enter the register as a profession. And we're not always getting that support from university sector. And where's the NMC in that? Where's the NMC to say to the universities, we need you to be really clear what student expectation is about entering the profession? I know sometimes that's a controversial thing to think about, but I think that student expectation is one of the challenges that we face in recruitment and retention. The other thing is financial challenges. You know, our students are struggling. The RCM produced this report. These aren't my words. The RCM released this recently, and it was really glad. We all knew that this was the case, but to have it there written down in a document is really important. We know students are struggling. We know they're on the breadline. We know that they cannot cope with driving to practice because they don't have any money. They can't manage their childcare responsibilities. So why are we expecting them to be able to juggle a full academic degree, 50% of placement hours on top of it, and make them pay for it, and take away whatever entitlements they might be entitled to because they might be earning a little bit more? They all have jobs as well. How do you manage? How do you manage? We've got to be hitting those challenges. We've got to get political. We've got to say something about it. And I would also suggest that this financial burden is also the big cause of well-being and mental health challenges. And those of us working in higher education will know that our students really do present with complex issues now. The workload is immense for them. The demands of the programme that we present to them to gain proficiency. The length of the programme. The length of the programme is very challenging. You know, it's not a standard academic year. We're expecting them to work a lot longer, and they've got to do their study and their practice-based learning as well. Staffing levels are challenging out there in practice. So practice-based learning for students is challenging. The compassion fatigue they see in the workforce and the challenge for practice supervision and assessment. And students are telling us they're really anxious about raising concerns. And I think students are exposed, aren't they? They're often exposed to poor practice. They're exposed to challenging situations, safeguarding, public health concerns, morale, burnout, bullying. Our students are exposed to that, and often they don't know how to raise concerns with us. Now, we've got some solutions. We've got some great solutions. This is just one that I'm showing you from Wales, but I know this work is going on across the UK. We have a toolkit to support students to raise concerns, because one of our challenges is to begin to prepare them right from day one to be those practitioners, those professionals who are prepared to speak out and say this is not acceptable for the people that we care for. Saying that, you know, we are fortunate. We have got standards of midwifery education. We've got standards of proficiency for midwives from the NMC. And we're really fortunate because these are evidence-based standards. Let's not forget that. They're based on evidence. And the other thing is, these are human rights-focused standards. That's what we want from midwives. It talks very clearly about midwifery-led care. You know, the WHO is just looking at implementing midwifery models of care globally. We've got it in our standards. We talk about continuity of care. We talk about continuity of carer. But actually, whilst these are brilliant, I believe the NMC missed a trick. They missed a trick. Why didn't they come out? Why didn't they tell us about length of programme? We used to have 45 weeks. Our programme is still 45 weeks, as many of yours are. We can't fit these education standards into less than that. We need 4 years to educate midwives. I know here at Leicester you do that, but you know, I really want to appeal. If we're looking for challenge and how to meet those challenges, let's be kind to ourselves and say, if we want the best midwives, we need to have the best education, and cramming it into an academic year to fit with HEIs doesn't work. I'm very conscious I could go on forever, so I've got to really be careful with my timing. Nicky's looking at me here. 5 minutes. I also want to say that actually I want to challenge the RCM on that as well. We have a professional college. I work as head of health professions now. So I work with HCPC, I work with physiotherapists, occupational therapists. I can tell you the Chartered Society of Physiotherapists has really clear guidelines that universities have to adhere to. They can't turn around and say to physios, no, you will cut this, because actually the CSP says no. Even though they've got HCPC as well, where's the RCM in that? Why don't we have a college that says no to the universities? You can't do that. Then maybe we'd have some traction as educators. So sorry, controversial, but I'm putting the challenge out there. I'm putting the challenge out there. So we know maternity care is changing. I'm not going to go into this in detail. You know there's increased complexities, comorbidities. But what worries me the most is the increasing interventions in maternity care. Increased induction of labour, increased caesarean section rate, increased mortality rates in the UK, increased trauma, inequities, inequalities. It's really worrying, you know, decreased satisfaction. We've got to act, we've got to do something as midwives, and that starts in education. So there's a challenge for our students to achieve their numbers of births because of the complexities that are going on out there. So is it time to be looking at that? You know, we know the European Commission is looking at the EU directive currently. We won't go into that. We haven't got time to talk about it this morning. And I know we're no longer in the EU. But the NMC has adopted the directive, even though it's not called that. We need to be really looking at the evidence and what is right for practice here in the UK. And you may wonder then, why do I put the SDGs up there? Well, I want to say we actually need to be educating midwives to be addressing the SDGs. Do we think about SDG 13, climate change? Do we think of, you know, what is the impact on midwifery, but what's the impact of us as midwives on climate change? Our students are coming in far more aware of this than we are in our generation. We need to get smart. We need to be sorting this, and we need to be educating along the Sustainable Development Goals because we work in a global society. So how are we going to meet these challenges? Well, you know, if you want something you've never had, you've got to do something you've never done. We really need to take action. This is from Dr. Amelia Tuapolatu, who's the chief nurse of the WHO, and she said we need action, action, action. Strategy is all well and good, but it's no good without action. We as midwifery educators need to be making a stand, and we need to be making a stand locally in our HEIs, and believe me, I know how challenging that is. I'm in a HEI that is really in a difficult position at the moment, as most are in the country, and Nicky's going to go into the reasons why that is. But we need to be strong for our professional programmes because they're not always understood at university level. Oh, wrong way, sorry. I've gone too far now. There we go. We need courage to tackle the big issues. Here's another recent publication from WHO, which Heather's in the audience. You know, we need to be tackling racism, equality, diversity, inclusion. We need to be thinking about what do we need to do so that our students start their midwifery career ready to be the right people to care for women, babies and families. We need to be looking at bullying. Bullying is rife in the NHS. We need to be tackling that from the beginning. Incivility. We know civility saves lives. How many of us talk about that in our programmes? I'm fortunate. We devised our programme with a year one module on human rights and fundamental freedoms. That's a module. We talk about incivility. We talk about unkind behaviour and the consequences of that right from the beginning, because that's what our students need to grow up with. Do you know, I saw this picture. I was very fortunate on holiday last week in New York, and this is outside the Rockefeller building. And I can't even see it now, but on the thing it says... Turn round. Oh, turn round. There we are. Wisdom and knowledge shall be the stability of thy time. I thought, wow, that's quite profound. Do you know what? We've got wisdom, we've got knowledge, we've got great evidence. Do we use it? Not always, I suggest. But high quality care comes from evidence-based care, and that requires high quality education. So for people to receive the best, the safest care, we need wisdom, knowledge, skills, compassion and kindness as the fundamental cornerstones. And I've used this slide... Oh, I've gone the wrong way again. I've used this slide before because it really spoke to me when I was coming into land on a flight some time ago. I wasn't in the pilot, but I looked out of the window and I saw the runway, and this is what I saw. And these guiding lights are exactly the same everywhere in the world. Every pilot knows these guiding lights, and they can guide that plane into safety because they're the same wherever you go. You know, we've got guiding lights in midwifery. We need to make sure that we're all using them in the same direction to effect the changes so that we can tackle the challenges in midwifery education. It does feel it's a big mountain at the moment. It really does. But we have to have one voice, and we have to be using these universal lights. You know, we have standards that talk about universal care. You know, let's use the evidence we've got to make education the right education for midwives of the future. And that's me.